Okay, hello. Um, this is Kanyanta MM, and this is a lecture that I'm recording on health assessment. Seeing that uh, time we will not have time to meet in a synchronous manner where we are able to interact. I teach and you're listening. Sometimes I'll have to record lectures and give them to you so that you can go through them, and then if you will have any questions you can ask later. So this particular lecture, I am recording health assessment. Okay. Now you will, I do understand that as you learn your adult medical nursing or adult medical surgical nursing, you do have a background of having learned about health assessment in general. For those that are pursuing, those that are studying adult medical nursing, the quota students, I believe you had learned health assessment when you were studying fundamentals of nursing. And for the adult medical surgical nursing group, you have covered this topic in your prior learning at diploma level. So I do believe that this is some sort of revision for each of the two groups. So let us go into the details of this particular lesson. We are looking at health assessment. So basically, when we talk about health assessment, okay, the word itself, assessment, I must say, it basically refers to measurement. So you want to measure different aspects of this patient in order to come up with a decision on how you're going to care for this patient based on your findings from the assessment. So conducting a health assessment basically involves collecting, okay, where you gather data, validating and analyzing subjective and objective data, okay, to determine the overall level of physical, psychological, social, cultural, developmental, and spiritual health of a patient. So this is what is involved in health assessment. It involves collecting data and validating this data. By validating, we're simply referring to confirming or verifying whether the data that you are collecting is actually accurate and correct, the process of validation. It also involves analyzing, okay, where you try to understand, to put, to bring pieces apart of those information so that you can understand them in detail, and then you bring them together to make conclusions. And the kind of data that you collect is two types, basically. We have what is referred to as subjective data, which we also call symptoms, and we have objective data, which is also called signs. And the health assessment, basically in nursing, looks at all aspects of the human being. So we are not only concerned about collecting data on the physical status of the patient, but also the psychological, social, cultural, developmental, and spiritual aspects of a patient's health. But then what do we mean when we say subjective data? So subjective data, these are simply data that are experienced, or basically data about a patient's experiences, or data about that which is only known by the patient and you cannot see it. Okay, these are gathered by verbal report during the health history. So subjective data are known only by the patient. Examples of subjective data are pain. So if a patient reports pain, you're not able to see the pain, but the patient feels the pain. In other words, when we talk about subjective data, like I said, we're referring to symptoms, what a patient feels and experiences, and they report it to you, the healthcare worker. If a patient tells you they are feeling nauseated, that is a symptom. And the kind of data that a symptom is, it is subjective data because it is told from the patient's perspective. And it may vary from one patient to another, so it is subjective. Okay. Then objective data are directly observed or elicited through physical examination techniques. So when we say objective data, we are referring to signs. We're referring to what you, the health worker, are able to see on the patient. Okay. So for example, if you look at a patient and you observe that this patient has, for example, they have bluish discoloration of the skin and the mucous membrane. We call that cyanosis. That is a sign because you, as the health practitioner who is examining this patient, have seen that on the patient. So what you see on the patient is a sign. What the patient tells you is a symptom. And symptoms are part of subjective data. Signs, objective data. I hope that is clear. So at the end of this lesson, basically, you should be able to define assessment, then you should be able to state the types of health assessment, and then describe health history taking. So let's move on. What exactly is assessment? So assessment is the collection of comprehensive data that is pertinent to a patient's situation. When you assess a patient, what you're simply doing is that you are collecting data that is important or pertinent to a patient's health or situation. And assessment itself is, it has two primary components. Okay, so there are two primary components to assessment. There is the first one, which is known as the nursing history. And nursing history is basically collection of subjective data because as you collect history, the patient will tell you what they are feeling, okay, how they are feeling. Those are symptoms, and that is subjective data. So the second primary component of assessment is the physical examination, which involves collection of objective data. So these are the two primary components of assessment. We have the history, and the second one is the physical examination. Then there is a third component, okay, which is the secondary component. Remember the first two, that is the nursing history and the physical examination. We're saying these are primary components. So the secondary component is where you review diagnostic tests and investigations that you requested on a patient in order to confirm a diagnosis. So the third component is where you look at diagnostic tests. So there are various types of health history that of a health assessment that you can conduct. In other words, there are different types of collecting data that is pertinent to patient or situation. Okay, so let's look at the types of health assessment. The first, we actually have, I should mention that we have 4 types of health assessment. Okay, we have the comprehensive health assessment. Then we also have the problem-based or problem-focused assessment. We also have the episodic or follow-up assessment. And lastly, we have the screening assessment. So let us just go back to the comprehensive assessment and look at what it entails. So comprehensive assessment involves detailed history or physical examination that is performed at the onset of care. For example, on admission to hospital. This type of assessment covers problems that are experienced by the client, as well as health promotion activities, okay, disease prevention, and it also involves assessment for problems associated with known risk factors. So what we simply mean is that when we say comprehensive, the word itself, comprehensive, means detailed. So a comprehensive assessment, it is a detailed, okay, assessment of the patient. When you collect history, okay, from the patient, you collect a detailed history. When you conduct a physical examination on this patient, you will conduct a detailed physical examination. That type of assessment is a comprehensive assessment. I hope you're able to follow. Just to remind you that we're saying um, assessment, okay, is in three parts, basically. The first two are primary components, then the third one is a secondary component. So the three parts of the health assessment are that number one, there is history taking. Number two, there is physical examination. And number three, there is review of diagnostic tests or investigations that have been requested of this patient. And the first one is history taking, the second one is physical examination, the third one, investigations. So when we talk about a comprehensive health assessment, we are saying whatever you do on the patient, whether you're collecting history, or you are examining the patient, or you're looking at investigations, it has to be detailed. And this is a type of assessment that is conducted on admission. Okay? And basically, the information that you collect will cover all aspects. You will look at the problem that the patient is presenting with at that particular time. You look at what they do for health promotion. You look at the activities they undertake to prevent diseases. And you'll also try to find out the possible risk factors which they may have. Okay? So information that you obtain through a comprehensive health history is what you use as a baseline for comparing later assessments. You use this to compare with how the patient will fare as you continue nursing them. One other thing I need to emphasize with a comprehensive assessment is that this type of assessment is done in non-emergency situations, okay? Because you need adequate time with the patient in order for you to conduct a comprehensive health assessment. So it's done in non-emergency situations where you have the luxury of time. In emergency situations, the type of assessment that we do is different, and we shall look at it. Let's look at the problem-based or problem-focused assessment. Okay, this is the second type of assessment. So the problem-based or problem-focused assessment involves history and examination that is limited in scope to a specific problem or complaint. Okay. With the focus, as the name entails, problem-based or focused assessment. What it means is that when a patient presents with a particular complaint, your assessment will be focused. It will be centered on that particular complaint which the patient has presented. So the history that you collect will be history that is revolving around that one complaint which the patient has presented. When you conduct your physical examination, you are focused on the complaint or the main problem that the patient has come with. You will not be interested in, for example, health promotion, asking about health promotion activities. So do you go to the gym? That may not be necessary. An example is that if a woman comes and they are complaining of abdominal pains, usually you want to find out what is causing the abdominal pains. So as a nurse, you might want to ask questions about the urinary system, because you're thinking that perhaps these abdominal pains could be due to a urinary tract problem, such as a urinary tract infection. You will ask about bowel problems because you're thinking, okay, abdominal pains, this could be due to perhaps gastroenteritis, okay, or there could be any inflammatory process occurring in the bowels. So, or maybe you are thinking it could be a problem with the appendix. So everything that you do, the questions that you ask will revolve around the complaint, which is abdominal pains. Okay. You may want to ask about allergies because some people are allergic to some foods. So for example, certain people react to gluten. Okay, others react to um, milk products. Okay, lactose. Some are lactose intolerant, so they may have abdominal pains if they've taken something that they're allergic to. You want to ask about menstrual history because you're thinking, okay, perhaps this is painful. These are just painful menses that this woman is experiencing. And then you want to assess vital signs and abdominal structures during physical examination. So your assessment will be focused on the complaint, which is abdominal pains. Your questions will revolve around what could cause these abdominal pains. Your physical examination will look at examining the abdomen because that's where the problem is. Okay, so that's a focused health assessment. Now, this is the type of assessment that is usually conducted in the emergency department because in the emergency department, you do not have time to conduct a comprehensive health assessment. So you go straight to the problem that the patient has presented with. Okay, so despite the fact that you're focusing on the problem, you still need to consider underlying health status of the client as well. So despite the fact that you're looking at that one particular problem, that problem could be caused by derangements in systems that are not even related to what the patient is talking about. An example that I can give you is that certain times, if a patient has congestive cardiac failure, okay, they may present with hepatosplenomegaly, especially if they have, you will learn these things, but especially if they have right-sided heart failure, okay. The liver may be affected and also the spleen. And so a patient might have pain in the right upper abdominal quadrant. And in that case, the cause is the failing heart, but then the symptom that the patient is presenting with is an abdominal symptom. So that is why we're saying, even though you're focusing on the problem itself, you need to consider the underlying health status of the client as well. Because sometimes your patient will tell you they're having abdominal pains. The problem really is not the source of the problem is not the abdomen itself. It's the failing heart that is affecting the liver and the spleen. Okay. So that is focused health history. Please remember focused health history in emergency situations. Okay. It is brief. It revolves around the main complaint that the patient has presented. It is limited in scope. Okay. The other type of assessment is the episodic or follow-up assessment. This one is also known as time-lapsed assessment. It is also known as ongoing partial assessment. So this type of assessment will concentrate on identifying health problems in order to monitor, okay, positive or negative changes and to evaluate the effectiveness of interventions. What we mean is that an episodic or follow-up assessment is the one that you conduct to see whether your patient is improving or not. So for example, when you admit a patient with a headache and you administer analgesics to try and reduce that headache, to try and alleviate the pain, you would want that after 30 minutes perhaps, or after an hour, you would want to reassess the patient to see whether there's been any improvement or there's been a reduction in the degree of pain that the patient is experiencing. When you go back to your patient to assess them, the type of assessment that you're doing is an episodic assessment or a follow-up assessment. Okay. It is used for patients with chronic illness. Okay, for example, you could have seen your patient who came in with hypertension. The first time you saw them, probably you conducted a comprehensive health history when you first met this patient, and then you sent them home on antihypertensives. But then when they come back, you'd want to see whether their profile for blood pressure has improved. So what you're doing when your patient comes for another visit is actually an episodic um, assessment. Another type of episodic assessment is shift assessment, okay, which is performed by nurses in acute care settings to identify changes in the patient's condition. So as nurses, you will be required to hand over a patient at the end of your shift to the nurse who is taking over from you. At that point, when you're handing over the patient, there is an assessment that will take place because the nurse who is taking over will want to see the patient's current status. Okay, so as you're handing over a patient, you're actually doing a follow-up assessment. This is Mr. JB. He came in this morning. He was admitted with hypertension. His blood pressure on admission was 180 over 110. He was put on he was put on nifedipine and also maybe amiloride hydrochlorothiazide, and blood pressure that was taken 20 minutes ago was at 150 over 90 millimeters of mercury. So what you have done is that you have given an episodic assessment to the nurse who is coming to take over from you, because you've taught them how the patient was, and after a period of time, how they are now faring. So that is an episodic or follow-up assessment. The last type of assessment that we'll discuss is the screening assessment. Now, a screening assessment, this one is usually short and inexpensive, and it is focused on disease detection. For example, just screening a group of patients or group of clients, just checking their blood pressure in order to see whether any one of them is hypertensive. What you're doing is you're doing a screening assessment. When you go, for example, to a shopping mall and you carry your blood pressure machines, you just want to check people at the shopping mall, those who want to have their blood pressure checked. As they come to you, you're actually doing an assessment because you're collecting data about their health. But the type of assessment that you're doing is a screening assessment because you just want to identify those with a disease, okay? So those are the 4 types of assessment: comprehensive assessment, problem-focused assessment or problem-based assessment. Then you have the episodic assessment, and finally, the screening assessment. Let us now delve into health history. Remember, this is the first component of the health assessment. Remember, we said health assessment has 3 components. You have health history, you have physical examination, and then investigations. So the first one is health history, meaning when you meet a patient, when your patient comes to the hospital, the first thing that you do is that you collect history, okay? So health history, okay, or history taking, this is a process of collecting and documenting subjective data about a client through an interview process. This is the process where you collect and you write down subjective data. Subjective because you, in the health history, you will not report information that you are seeing, but you report information that the patient will tell you. It may either be the patient telling you, or it may be a significant other to the patient, or it may be a fellow health worker that will tell you about this patient. But as long as you're collecting subjective data, what you're doing is that you're collecting health history. Other scholars have said it's a collection of subjective data that provides a detailed profile of the patient's health status. Okay? Let's look at the types of health history. So we have different types of health history, and you will see that the types of health history also are basically related to the type of health assessment that you're conducting. So if you're conducting a comprehensive health assessment, remember the one that we said is detailed, the type of history that you collect is a complete or comprehensive health history. Okay? If you are conducting an episodic assessment or the time-lapsed assessment, then the type of history that you collect is the interval health history. Okay? And then if you're collecting a problem focused, okay, problem focused assessment, okay, the type of history that you collect is the problem focused or the chief complaint focused history. So let's go back to the complete or comprehensive health history. This is mainly done at the initial visits, okay, usually on a non-emergency basis and upon admission to the hospital. It will provide a baseline with which to compare, okay, whatever else you will see on the patient as you continue caring for them. So this is the type of history that you collect during a comprehensive health assessment. The next one is the interval health assessment. This one is done at subsequent visits. Okay, it's done at subsequent visits to build on preceding visits to the health facility. Remember, I said this type of history, you collect it when you're conducting an episodic health assessment. That is why we're saying it is done at subsequent visits, because there will have been a period of time that will have passed from the last time you had assessed the patient to this time that you're now assessing the patient. So we call that interval history. This is a type of history where you say, like the example I gave you earlier, where you had met a patient, maybe the patient came in with diabetes mellitus, sugar disease. When they came in at first, okay, they were experiencing severe weakness, they were usually thirsty, drinking a lot of water, passing a lot of urine. When you put them on drugs to treat the blood sugar, okay, the diabetes mellitus, you send them home. When they come back, you want to ask them questions. So how are you doing now? Are you still feeling weak like you were feeling the last time you came? Then they'll tell you their current situation. The kind of history that you're collecting by doing so is interval health history, because a period of time has passed. Then there's the focused, okay, the problem focused history, which we also call the chief complaint focused history. Why do we call it chief complaint focused history? Because remember, this is the type of history that you will collect when you are conducting a problem-based assessment or a problem-focused assessment. So we are saying it's a chief complaint-focused health history because it will just it will revolve around the chief complaint, the main problem that the patient has come with to the health facility. It is done in busy institutions and it is focused on the problem at that particular time. This is what we do even in emergency situations. You just collect a problem focused history, and I'll show you how to do it. Okay. So why should we collect health history? What is the purpose of health history? So the purpose is to develop relationships so that trust is built between the nurse and the practitioner. As you begin to collect this health history, you're also interested in building a relationship with the patient, in establishing a rapport. Secondly, you want to obtain information, of course, to obtain information regarding the patient and the patient's health status. That's why we collect history. We want to find out how this patient is doing health-wise, and also to find out about them. Who are they? Where do they stay? What do they do? Okay, and then we also ask about their health status, as you shall see. The third purpose is to validate appropriate health and illness information presented by the patient or found in the patient's record. So we want to validate, to confirm, to verify whether this information that we've been given by the patient or the information that we found in the record is correct or not. So, for instance, you may see that in the patient's file, it is written that the patient had a surgical operation in the year 2010. So you want to ask them as you collect history, um, did you have an operation in 2010? And they'll tell you, yes, I did. What you are doing is you are validating the information that you've seen in the patient's record to confirm whether what is in the records is actually accurate. That is the other purpose of health history, to validate health information. Okay. The fourth one is to formulate a contract between the client and the nurse. You want to set terms of your, to declare the rules of engagement with your patient. You want to familiarize them with their rights, okay, and also their obligations as they are under your care. Then also the other purpose is that the collecting health history acts as a guide for the okay. I think there was an interruption in the recording. Nonetheless, we will continue. Okay, so we were looking at the purpose of health history, and in a nutshell, we said 1, to create a rapport, 2, to obtain information about patients themselves and about their health, 3, to validate information, 4, okay. So I was saying that when you collect health history, the health history that you will collect will help to, it will give you an idea of where you need to concentrate as you conduct the physical examination. For example, a patient who is presenting with chest pains, automatically, because the patient has told you that they're experiencing chest pains, you will know that as I examine this patient, I should listen to the chest, I should listen to the sounds coming from the lungs, I should listen to the heart of this patient in order to ascertain what the patient has told you, which is chest pains, to ascertain where they're coming from. So those are the purposes of health history. Let us delve now into the various components of a comprehensive health history, because once we've covered the comprehensive health history, we are able to do any other type of history. Okay, so let's look at the components of a comprehensive health history. So there are basically 7 important components that you will include in a comprehensive health history. The first one is that you collect biological data. We also refer to this as the biographic data. You need to look at reasons for seeking healthcare. Okay, you need to look at the present health status, which we also refer to as the history of present illness. Then we look at the past health history, the family health history, personal and psychosocial history, and then review of system. So let's look at each of these in detail, starting with the biological data. So this one, the biological data is collected at first visit, and then it is updated as changes occur. So this is basically the demographic information about the patient. So you want to record the patient's full name, okay? In your health history taking, you indicate the full names of the patient. not the surname and an initial. That is not acceptable because a lot of people may have similar names. Okay, so you want to record the full name. You record the gender of the patient, okay, whether male or female, and nowadays even transsexual. Okay, especially if you're working in settings that are outside of Zambia, you may meet people that are transsexual, and you might want to take note of that. Then you want to indicate the address and the phone number. This will help you in case you need to do a follow-up visit. It will be easy to track the patient and to locate the patient. Then you record the date of birth. Okay, you need to record the date of birth because this is it is a more accurate guide to the age of the patient as compared to just asking the patient, how old are you? Because certain patients may not be literate, or at that particular time, they may be delirious, they may be in a confusional state, so they may not be able to calculate their age accurately based on their date of birth. But if you can elicit, you can tell, or you can get information about the date of birth, then you can now calculate how old the patient is and confirm with the patient. For example, you can say, so when were you born? They'll tell you, I was born on, let's say, for instance, 30th July 1987. Then when you calculate, you say, okay, so you were born on 30th July 1987. So you are 34 years old. Are you 34 years old this year? They'll confirm, yes, I'm 34. Okay, so that is validating information. Then you want to collect information about the race or ethnicity of this patient. Now, it's important to know the race because there are certain medical conditions that are prominent among certain races. For example, maybe let's talk about the African Americans. Okay, maybe with regards to medication, African Americans may not tolerate certain types. Okay, so we'll carry on. Okay, so that's the biological data. I was talking about collecting information about the race. So